Happy St. Patrick's Day, everybody. I got my green on my Crocs. Total accident. I forgot that was St. Patrick's Day. Um, this is it. This is the last part of Unit 2, muscles. We've already talked about the gastroc and the soleus. So we'll talk about the rest of them. We're going to do things a little bit differently today. Now we've done how I teach muscle function based off of how they cross. And so it should be uh, in and enough where I could show you a muscle and say, okay, guys, this muscle crosses this and this. You tell me its function. I want to try to reverse engineer it today to see if that really helps with our understanding. So remember, the ankle and the subtalar are like the skateboard. You got the wheel and the wobble. The ankle is the wheel. It's about our bilateral axis at the ankle. So anterior crossing muscles are going to be dorsiflexion pullers, and posterior crossing muscles are going to be plantar flexion pullers. Our wobble, the subtalar and transverse torso joints, the average axis for a subtalar joint, because it's a gliding joint, but the axis is in between the first and second toe. Has anybody ever heard of toe off? Like there's a reason it's not called toes off, because your big toe, it's a big part. And so when you toe off, so your subtalar joint kind of runs in between your first and second ray. So this is your lock, meaning medial crossing muscles are going to be inversion pullers and lateral crossing to this anterior posterior axis are going to be eversion pullers. Okay. Here are the muscles you're going to be accountable for in list form. And notice for all of them, I put ankle, 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 ankle. That's either crossing anterior, posterior. And then for the subtalars, that shows you medial or lateral. Okay. Here's the circle. Remember, this is not an intersection. This is an overpass. Ankle joint is on top of the wobble joint, on top of the subtalar. But you have so many muscles that influence both. That's why we combine it into one circle. Same apartment complex, different apartments, top floor, bottom floor. Start off with the good old tibialis anterior. Here's a couple views of it, guys. Tibialis anterior, a muscle on the anterior part of the tibia. But again, it's all about cross. So you look at the belly of this muscle and you say, well, that's a lateral outside muscle, but its function doesn't care about its origin side. It's about where these muscles cross. So if I told you that the tibialis anterior, again, we're going to just try it a little different today. If I told you that the tibialis anterior runs anteromedial, in other words, it has an anterior cross and it has a medial cross, right away we should be to the point where you're like, oh, well then it must be a dorsiflexor and an inverted. And again, where does it go? Where does it insert? Is irrelevant to how it crosses. It can insert on the base of the third, the base of the second, the base of the first. It could do a loop-de-loop and make a pretty bow at the top of the foot. It doesn't change that it crosses anteromedial. It does. It's going to be a dorsiflexor and an invert. So tibialis anterior to the bilateral, and medial to this anterior posterior that would run between the first and second toe, right? Tibialis anterior. Dr. Torres, leave this thing several years ago where he would take his seam on his pants and he would show kind of how on this would be the zipper, but he would show on his seam kind of how that muscle would run and cross. So like if you dorsiflex your foot and you feel that tibialis anterior tighten up right there. So it feels like it's on the lateral side, which it is, but it crosses medial. And so that's the reason why it would be pulling in a direction of inversion. Okay. Ankle dorsiflexor subtalar joint in further. In addition to the tibialis anterior in the same quadrant, in other words, anteromedial, we have the extensor hallucis, potato, longus. Hallux is a word for big toe. Hallux is a word for thumb. So you have a specified muscle that crosses your ankle and subtalar that goes to the big toe, basically. So think of it like this, guys. When you have shoes on, Crocs or tennis shoes, and you feel your toes kind of pushing on the toe box, the push from those toes are influencing ankle, because to get to your toe, they got to cross the ankle. I mean, I know we haven't gone upper extremity, but imagine if I had a muscle to get to my fingers, and if it crossed the wrist to get to my fingers, and it pulled here, it's also going to want to pull there. Does that make sense? If I had a string and I pulled it, it's going to pull my fingers here, but if it crosses my wrist, it's also going to want to pull my wrist there. It's the same concept. To get to the big toe, it's going to cross my ankle and subtalar joint to get. So that's why a toe puller has a function at the subtalar and the ankle, because to get there. Now, some muscles, this will be for graduate school, but some muscles we call intrinsic, like some little small little intrinsic muscles. So all of the ones that we're having in our class are what we call extrinsic. In other words, to get to the toes, you're going to cross from the outside. So you see that extensor hallucis longus. See if I can isolate it by itself. There's the extensor big toe string going all the way to the end of the big toe. There's our tibialis anterior. There's our big toe extensor. Can everybody see how if muscles can only pull? So if I took this string and I pulled it, it would be a dorsiflexion puller. In addition, I'm going to use the green Sharpie today because it's St. Patrick's. Here's our axis for our wobble, and you can see how it's more medial to the anterior posterior axis. So that's why it's an inversion puller. Dorsiflexion, invert. Tibialis anterior. So following it down, lateral, 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 curve, crosses medial. Dorsiflexor invert. Dorsiflexors, tibialis anterior, check. Extensor big toe, hallux, check. You also have extensors to your second, third, fourth, and fifth toes. Your big toe gets its own, because your big toe is kind of an important digit, kind of like your thumb is an important digit. The other four kind of get one muscle that fans out to the four of them to kind of work in unison. We call that the extensor digitorum. So let's take a look at the extensor digitorum. Here's a picture of it right here. I'm going to show you several pictures. But you see how that muscle comes down, and then from that one central tendon, it flares out into fifth, third, and second. In other words, you can about imagine it'd be really tough. You can only use your intrinsic, but to like individually move your pinky, your second, your third, and your fourth. You don't have the dexterity at your toes like you do in your fingers, so you don't have specialized toe movers. I think you can see what I'm talking about right here. This would be your specialized big toe, and then here's your digits fanning out into second, third, fourth, and fifth. These would be little intrinsics that are not, we're not going over those in class. We're talking about our major extrinsic. So again, they are toe extensors, yes, but to get to the toes, we got to cross the ankle and the subtalar joint. And that's why they have function at the ankle with the subtalar joint. So remember in class on Friday, we talked about how when you heel strike, you need dorsiflexors, right, to eccentrically transition between heel strike and foot flat, right, to sync that motion up so it doesn't happen too fast. Well, those toe muscles are pushing up against your toe box to help as dorsiflexors to transition. So if you notice when you heel strike, you'll feel your toes pushing up against the top of your foot. That's your toe extensors trying to help as dorsiflexors. And also remember, if you can't see this well, I wish they had better visuals, but this is all in your PDFs. This is all on Google for you. All right, so far we have a tibialis anterior. Eventually, I'm going to teach you about a tibialis posterior. We have an extensor big toe, extensor hallux. Eventually, I'm going to show you a flexor hallux. It mirrors all those muscles. So it's not as many as it seems. We have some extensor toes. We're going to have some flexor toes. And so the real oddball of all these are this family of peroneals, these peroneals that we have called the longus, the brevis, and the tertius. The tertius is like a cousin, and that's the one we're going to talk about right here. So the peroneus tertius, potato, potato. And again, I want you guys to, now we should be able to look at the muscle and say, okay, here's the bilateral axis. You see where the little arrow is? There's the bilateral axis. Does that muscle cross in front or behind? Is it anterior or posterior to the ankle bones? So this is a lateral view, right? So we're looking from the side, and the cursor is literally on the bilateral axis. So does this muscle cross in the front or the back? In the front. So is it going to be a dorsiflexor or plantarflexor? Dorsiflex. Okay. Do well.
Yes, exactly. Sure. It's asked like the pelvis, this muscle throats.
You're
Just our.
Yeah, this is just for your understanding, right? So if all I did was give you, it's a good question for understanding. If all I did was give you this and this, so I'm trying to show you why. I'm trying to show you why these muscles get slotted the way they slot. So it's more for your understanding. Like, don't just take my word for it that the tibialis anterior is a dorsiflexor. Look at how it crosses in the front, so that your circle makes more sense. Oh, okay. the tibialis anterior crosses in the front, and I see how it crosses in the front, so it better helps my understanding of its function. Yeah. But that's the intent of how I teach. So, so tibialis anterior, extensor hallucis anterior. Now, one thing I forgot to say, I'm glad you kind of called me back, is if our wobble is in between our first and second digits, there's no rule that says everything has to be linear. You know? Our wobble is in between our first and second digits. So that's why our entire digitorum, second and fifth, are eversion pullers because they're lateral to the anterior posterior axis. Does that make sense? So that's why your digits are eversion pullers, because they are lateral to our AP axis. Our AP axis runs here. Lateral. So if you were doing a TheraBand, you were working everters, those toe extensors would recruit. Okay. So again, tibialis anterior, anteromedial, dorsiflexor inverter, extensor big toe, anteromedial, dorsiflexion inverter, digits, anterolateral, dorsiflexor everter. Sense? And then our tertius is anterolateral, dorsiflexor everter. So far, we've had 4 major muscles that are dorsiflexion pullers. Tibialis anterior, extensor big toe, extensor digits, peroneus tertius, extensor big toe, hallucis, digitorum. 2 of those are inverters on the wobble, 2 of those are everters on the wobble. Now the tertius has 2 cousins that are also lateral, but instead of being anterolateral like the tertius, these peroneals are posterolateral. The peroneus longus and brevis. Peroneals. So here's the whole family. We've got the tertius, and then the longus and the brevis. Longus and brevis, I think I mentioned this for hip muscles, is actually a inference of tendon length, not muscle length. So in other words, when a muscle ends early and becomes a tendon early, that tendon is long. So a longus muscle actually has a relatively short life as a muscle. The tendon is like a tail, it's a long tail. Okay. The longus and brevis are referred to, I guess it could be any muscles. They're referred to as sister muscles. Sister muscles basically are 2 separately innervated muscles that have the same functions. So longus and brevis are kind of like twinsies. They both run posterolateral. So they have the same function. They do have different, and again, you'll learn this in grad school. I think the longus goes to the base of the 5th metatarsal, and the brevis goes up underneath to insert on one of the metatarsal heads. Like there it is. So in between the first and the second. So where my cursor is right there, that would be the longus, and then this would be the brevis. And again, that's going to be important for some of you. I'll give you an example. When I was at Auburn, the fellowship that I did in orthopedics was with youth athletes, and because their growth plates aren't fused, there's different things we need to check for when they have sprains and strains and breaks. We need to look for growth plate issues. So for them, when they sprain their ankle, their subtalar joint, we actually want to be a little bit more cautious in our imaging, because that tendon might have actually yanked off a piece of bone because those bones haven't sealed up yet, growth plate injuries. So So again, insertions of these things for some of you might be super important, but I got you for 3 months. And what's important for everybody is function, whether you're a personal trainer, whether you're going to be a therapist, whether you're going to be an athlete, whatever you're going to be, muscle function can be applicable throughout. So that's why we emphasize functions. The reason I think I like this picture too is sometimes you'll hear, I think I've given the analogy of cat and menu. Menu is French for cat, right? And so some textbooks might have a different name, but it doesn't mean that there's some new structure. It's just some variations of names might exist. For example, lateral collateral ligament is the same as fibula collateral ligament. So sometimes there'll be some variations of the names of these things. So for example, fibularis longus might be another name for the peroneus longus. It's the same muscles. So there's your peroneus brevis. So a couple things when we look at muscles, guys. Where does it cross? How does it cross? Doesn't go anywhere near the knee, so we don't have to worry about that. Crosses the ankle in the back, crosses the subtalar joint on the outside, posterolateral. So muscles can only pull, so when that thing is pulling, it's pulling in a direction of plantar flexion and eversion. Simple as that. Now, the use of knowing how it pulls can help with determining agonist, contraction, stretching, right? If it's a plantar flexion puller, we want to make sure we dorsiflex it. If it's an eversion puller, we want to make sure we invert it. Those are the useful things that we get by knowing how muscles pull, specifically to joints. If we were doing a manual muscle test on the peroneus brevis, it's a plantar flexor, so we want to try to dorsiflex so that it can, and it's an everter, so we need to try to invert it. Rinse, wash, and repeat. But it's all based off of hypothesis. So there's the brevis and the longus. Let's look at it from, so there's our family of peroneals. What do all the peroneals have in common? Tertius, longus, brevis, they're all everters. And then the longus and the brevis kind of have similar names. So they're sister muscles that are posterolateral, so they're both plantar flexors. And then the tertius is the cousin, who's an anterior crosser, who's a dorsiflexor here. Let's go back to our circles. Tibialis anterior, tensor hallucis, dorsiflexor inverters. Digits, peroneus tertius, dorsiflexor everters, longus brevis, plantar flexor everters. So we've done all of the dorsi and we've done all of the everters. Guys, the rest is super easy because we had, I told you earlier, we had a tibialis anterior. Guess what? We have a tibialis posterior. We had an extensor big toe. We can have a flexor big toe. We had some extensor toes. We can have some flexor toes. That's it. And then obviously the soleus and the gastroc, big pedal muscles. Those are the ones that are pushing our skateboard to propel us significantly. And those other kind of small ones do have some help, but a little bit of contribution. They're in the box score. But the big scores are our gastroc and our soleus. But those other ones are so important for our wobble, for our balance. Really important for our balance. And then obviously our dorsiflex is really important, again, for eccentrics transitioning from heel strike to foot flat through eccentric work. So again, we had a tibialis anterior. So we're going to have a tibialis posterior. Let's check it out, the TP. So really cool. I'm going to show you guys something I learned in college, an acronym. T, D, and H, Tom, Dick, and Harry in that posteromedial quadrant. you have these three tendons that kind of run posterolateral, tibialis posterior, flexor digits, and flexor hallucis, Tom, Dick, and Harry. And you'll probably learn this in grad school. The and part is actually a tibial artery. But Tom, Dick, and Harry. Now, those three compartmentalize in that posteral medial quadrant, right here in this groove, for a few reasons. One is, let me grab that angle and show you guys what I'm trying to babble about. All right, think of it like this. In the front, we have a heck of a lot more, let's say, surface area in the front. In the back, everything is much more compartmentalized with the calcaneus being back here, right? So in other words, you either, it's like a fork in the road. You either got to go this way or you got to go that way. You got to go there. So in the front, we kind of have a lot more area kind of spread out versus back here. Everything's tighter. There's tighter windows to cross relative to the calcaneus. Does that make sense? Okay. In clinic or school, talk about arches, right? The arches of your foot. So arches, and this plays into muscles, but obviously arches are important for dissipation of force. And the arches that we have in our foot are created by the structures of the bones in our foot. The tarsal bones create arch. You've heard of the plantar fascia, which is basically like a bowstring from our heel to our toes that help. And we have some specialized ligaments in here too. Spring ligament and deltoid ligaments and those things. But in addition, our muscles help us with our arches as well. Remember, one of the reoccurring things you hear me say, muscles not only help with mobility, but help with stability. Okay? So if you had a posterior medial crossing muscle that would kind of pull in the direction of inversion, you can kind of see how that muscle would help with our arch. And that's our tibialis posterior is of our inverters, it is by far the most responsible for trying to maintain arch support muscularly. So in therapy, you're trying to help people with arch issues. That's one of the muscles that we really want to try to get some fatigue resistance to, is that the tibialis posterior, arch pulling muscle. Because if you think about it, if you're flat foot, let's say this is a right, if you're flat foot, that's kind of recreating eversion more. And if you have an arch to your foot, that's more kind of like inversion. They may call it pronation, supination for the most part, right? This would be like inversion. This would be like eversion. And so that tibialis posterior, being an inverter, being an inversion puller, is trying to help maintain that arch from a muscular standpoint. So your tibialis posterior should give you a big clue to its ankle function. Crosses posterior. And then if you look at it, this is a back view. Is it crossing medial or lateral to that calcaneus? Is it on the inside or the outside? Inside, yeah. So it's a plantar flexor inverter. Does it high cross? So again, what I love about seeing these muscles cross is you look at that muscle and it actually originates and spends most of its time laterally. You look at that. In fact, if you didn't have the context of how it crosses, like in other words, if you just had, you see how these bones kind of have like some origin insertion, right? If you didn't have the context of cross, you would say, oh, well, here's where it starts, here's where it finishes, but how do you know whether it goes here or here?
Because if it goes here, it's doing a heck of a lot different function than if it crosses on the inside. So that's why we have to look at how they cross to really see their function. See how they go. Tom, Dick, and Harry. So there's Tom, tibialis posterior. Here's Dick, our flexor digitorum longus. So there's Tom, here's Dick, flexor digits. So we had the extensor digits, here's the flexor digits. Crossing posteromedial. Plantar flexor inverse. Helping with that arch support. Pulling on the toes, but to get to the toes, you cross the ankle and look there with it. Make sense? To get to here, you've got to cross here and you've got to cross there. Then here's Harry. Tom, Dick, and Harry. Posteromedials. Again, muscles serve a lot of cool functions. Mobility is primarily, but also stability, and in this case, trying to help keep your arch efficient. How do we know this is the soleus besides it saying soleus? Then across the knee joint, right? Remember that? So the soleus stops at the tibia, gastroc crosses the knee. So these are, and if you notice where they insert on the calcaneus, the big tendons called the triceps surae, that big Achilles tendon. This is what's propelling our scapula. It's big, powerful, wheel rolling muscles. And those other plantar flexors also help to propel the skateboard. Not as much, but very important for our wobble and very important for our arch support, muscular. Okay. I think that's kind of cool. These are our wheel influencing muscles, and all the other ones we did earlier are wobble, our balance. Now, our dorsiflexors, again, have that very important function of helping us transition between heel strike and foot flat, eccentrically allowing that plantar flexion to happen at a very specific speed so that we can gradually segue between heel strike, foot flat, and then toe off our push-off, okay? This is an example of the leg tension stuff that I talked about. So we've already talked about this lecture, but this helps to explain why this would be emphasizing gastroc and this would be emphasizing soleus because of the leg tension stuff. So that's it. Who are dorsiflexors? Tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. Who are everters? Extensor digitorum, peroneus tertius, peroneus longus, peroneus brevis. The laterals, the ones on the outside. Who are inverters? The medials, the ones on the inside. Tibialis anterior, extensor hallucis, Tom, Dick, and Harry. Tibialis posterior, flexor hallucis, flexor digitorum. Who are plantar flexors? The posteriors. Tom, Dick, and Harry, peroneus longus and brevis, and then our big scoring, the pedal pushers, the gastroc and the soleus. We don't have any rotation stuff, guys. Any rotation we have is from our knee, like this. But the reason we don't want to have any rotation is we don't want our talus to spin inside that socket, inside that board. So that's how high ankle sprains happen, is when you have torsion, like you land on the outside of your foot and something is trying to cause the talus to rotate inside the tibia and the fibula, and the ligaments that hold these two bones together get pulled apart. So that's where a high ankle sprain is happening here, because you have rotational moment torque happening here, and it's more than what the ligaments can withstand. Okay, so we don't want the ankle to spin. We want, think about it, the skateboard only allows roll and wobble, and that's kind of what we want here too. We want this to be our wheel, and we want this to be our wobble, but we don't want the skateboard to spin out. We don't want the car to skid. We don't want to have this kind of motion. It's a bad day. Okay? Wheel and wobble. How would we stretch our soleus? Well, it's a plantar flexor, so we want to make sure we dorsiflex. But we also indirectly want to make sure that that gastroc is on slack. We want those knees to be flexed, because if that gastroc is tight, we may end our dorsiflexion before our soleus could be the reason we end our dorsiflexion. Does that make sense? So we want to get that gastroc on slack so that we could go further into dorsiflexion and stretch our other plantar flexion.
That would be to say seated calf raises is better for working the lower back, like so.
Correct. And in our class, we would just say the muscle, right?
Yeah.
So what we would just say, seated would 100% emphasize the soleus as the predominant support, because the gastroc is on slack and can't pull as efficiently. It's still playing, but it's Michael Jordan. Well, that's a bad example because Jordan still scores a lot of points. But it's like the gastroc is playing, but it's playing with one hot hand behind his back. It's still going to contribute, still going to score. But if we're using the tug of war analogy, when that muscle's on slack, it can only pull with like one hand, as opposed to when it's lengthened, it can pull with both. Kind of one way to look at it. So I'm definitely not saying that the gastrocnemius just turns off or it's not there. It's just not pulling as efficiently. So something else has to take up that slack. All right, guys, let's do some practice. This would be an example of what I just said, how this ankle stretch would emphasize the soleus and the other plantar flexors because that gastroc is on slack. So therefore, it won't limit my dorsiflexion because it gets too tight too soon. This one would be great for gastroc because gastroc is lengthened at both ends. How about if I ask the question this way, from top to bottom, tibialis, and don't answer it right away, give it some thought, answer it in your mind. From top picture to bottom picture, and the 4 answer choices were tibialis anterior through concentric, tibialis anterior to eccentric, tongue twist, tibialis anterior through eccentric, tibialis posterior concentric, or tibialis posterior eccentric. Give that some thought from top to bottom. TA con, TAE, or TP con, TPE. And as always, feel free to discuss your answer with your neighbor. See if you got the same thing. See if you got something different. If you got the same thing, sweet. If you got something different, talk about it. Okay. Process. The TheraBand is trying to do what to example? Plantar, right? So if the TheraBand's trying to plantar, we need muscles that are trying to dorsiflex. We have a name for those. We call them dorsiflexion pullers or dorsiflexions. Who are those dorsiflexions? So we establish the agonist. Then we take it two different places for this question. We say, well, who are those dorsiflexion pullers? Tibialis anterior, extensor hallucis, extensor digitorum, peroneus tertius. Well, we could end it with tibialis anterior, right? So tibialis anterior is working for this exercise. Tibialis anterior is a dorsiflexor. What motion did I observe from top to bottom? Dorsiflexion. Sweet. Dorsiflexors do dorsiflexion through concentric contraction. So the answer based off of the choices I gave you would be tibialis anterior through concentrics from top to bottom. Does that make sense? And if I gave you from bottom to top, it'd be the same muscle, but the dorsiflexor would allow plantar flexion through concentrics. And again, I teach through repetition. If all we did was go off of the names of the muscles, tibialis anterior, because it doesn't have a pull in the name, that makes trying to figure out contraction more complicated. So it's like an extra step, but it's an important step to help us see, to help us transcribe muscles, external forces, and contraction all in the same language of motion. So in other words, the tibialis anterior being a dorsiflexor, now I could say, okay, well, if I'm using a dorsiflexor and I see dorsiflexion, if I'm using a dorsiflexor and I see plantar flexion, it helps make sense of the contraction. That's why we do what we do. It's like we're translating it into a language that's applicable for the muscles, the motion, and the contraction. Okay. All right, how about tibialis anterior or tibialis posterior? Well, let me ask something different. Peroneus longus or peroneus tertius? From left to right. What are the external forces trying to do to my ankle? Ground and gravity in this exercise are trying to do what to me? Trying to dorsiflex, good. It's trying to dorsiflex me, so I need muscles that are trying to plantarflex me. Peroneus tertius is not one of those, so I can eliminate that one and say, oh, the peroneus longus is one of those. I need plantar flexors. When I see plantar flexion, concentric. When I see dorsiflexion, eccentric. Okay, for this one, am I using extensor big toe or extensor digit? Don't answer right away. And again, I'm not disrespecting the others. I'm just specifically picking one on each side of the axis to see if you could identify who my work is. So hallux or digits, and I specifically went with extensors because one is on the inside and one's on the outside. So let's do our process. The TheraBand is trying to do what to my subtalar? Evert. So I need muscles that are trying to invert. It doesn't matter that this is on a left. If you're a circle person, it doesn't matter that your circles are rights. It's the same muscles. So in other words, once I establish I need inverters, I can still go to my right-sided circle and say, well, who are my medial crossing muscles? My tibialis anterior, my extensor big toe, my extensor big toe. Make sense? So I would need my inverters. When I observe inversion, concentric. Inverters do eversion, eccentric. But those muscles that are in that agonistic group would be all of the medial crossing muscles. Tibialis anterior, extensor hallucis, tibialis posterior, flexor hallucis, flexor digits. The wheel pushers, they don't need to waste their effort on wobble. It doesn't take a lot of force to balance. We need those things to pull on that calcaneus specifically to help push. They're not concerned with wobble. Make sense? Was this helpful? Okay, so what I would like for us to consider is Wednesday, maybe having some type of lab day where we can do manual muscle tests, we can do straight leg raises, we can do, if you guys have some TheraBands, we can bring it. I mean, we could always use gravity, but I'm hoping maybe Wednesday could be a lab day where we can really kind of figure out stretch, agonist, contraction. Maybe we can really develop and master these concepts by doing, to make sure that the last couple of days are just fine-tuning things. Okay, we're good. All right, guys. You have a good day.